Hello, I'm Ellie, host of The Healthy Practice. Today, I'm delighted to be joined by Dr. Rebecca Lewis, GP and Menopause Specialist and Director at Newson Health, the Menopause and Wellbeing Centre. In this episode, we're going to discuss the rise of menopause clinics in the UK and what this means for women's health. Why they're needed, the misconceptions that still exist around menopause, and how all healthcare practitioners can better support women through this phase. Now, why might this be important to you listening? You might be thinking, well, like me, you may very well be experiencing perimenopause or menopause symptoms right now, have people in your personal life who are, or you could be treating patients who are struggling with these issues. So we can all do more to better equip ourselves with this overlooked area of women's health. So let's dive into this episode. Welcome to The Healthy Practice, Rebecca. Can you tell our listeners a little bit about yourself?
Thank you, Ellie. Well, it's lovely to be here and to have a chance to sort of discuss menopause with your listeners. It's a really vital topic. So yes, a bit about me. Well, I qualified from Guy's Medical School in London in the early 90s. So some time ago now, and actually started off as an anaesthetist for a little while. Trained as an anaesthetist for several years, and then had a career switch to general practice and moved out of London and started as a partner up in Stratford-upon-Avon and stayed as a partner there for some years. And then slowly, the last sort of 10 years or so, got more interested in women's health and latterly menopause, and met the amazing Louise Newson, and we became friendly and started having lots of conversations about menopause and how little was known about it, not only in society but in medicine, and how important it was. And we started working together and founded a clinic in Stratford, and it's a private clinic because we couldn't get any funding for an NHS menopause clinic. And we have had that clinic now for about 5 years, and we now employ up to 100 doctors and see up to 4,000 patients a month. So we've got an enormous clinical experience of menopause, and it's such an important topic that actually, until I really specialised, I stopped doing the general practice now and just purely do menopause now. Until I really specialised, you really don't perhaps see the extent to which it affects people daily, and has always done so, but has been neglected and misunderstood, and women have been told they've got something else rather than menopause for centuries, really, often with masquerading with mental health symptoms. And so actually seeing the power of the treatment, the best treatment, of course, being HRT, is really phenomenal and can really be very, very helpful in many women. So that's what I do now. I'm a director here at Newson Health, and we see menopause and perimenopause in the clinic, patients in the clinic.
Yeah, and it's something that's quite personal to me as well. I just wanted to say a little bit about my experience, because this is kind of one of the reasons I wanted to get you on. I've been perimenopausal for about 3 years now, and I didn't know that was going on, and it was dismissed by my GP to start with as anxiety or nothing, or let's just keep an eye on it kind of thing. And I knew in myself, like, I knew what was going on. I kind of self-diagnosed. And I was just told I was too young, basically, to be menopausal. So despite knowing how I was feeling, identifying the symptoms myself, it's taken over a year now of advocating for myself to just get HRT treatment, or to actually get someone to listen to me before I started to feel better. So this fight and this misunderstanding is really something I'd like to talk about today, because it's been a battle.
Yes, and we hear this all the time. Actually, we did a survey of patients, and 10% of patients had to visit their GP 7 times or more to get the treatment they wanted, and a small subset had to wait for 5 years before they got onto the right treatment. 10% of women waiting a long time to reach a diagnosis, and they're often told you're too young, your periods haven't stopped, your blood tests are normal, it's not it's not menopause, it's mental health problems, or it's a migraine problem. And of course the root cause is neglected, and it's because we haven't had any education about it in society. I mean, as doctors, we're just products of our society, and I'm afraid menopause has been neglected forever, really, by our society. And we're now realising how important it is for women, and we now, thank goodness, live on average the age of 83, so we have 30 or 40% on average of our lives will be spent post-menopausally or without hormones, because that's what happens when the ovary stops working. We lose our female hormones, and we're now seeing that there's an increased risk to our health because of that, as well as causing quite profound symptoms in many people. But this has only been relatively talked about relatively recently in the history of medicine. And I was never really taught about much detail about menopause at medical school, a little bit, but not in great detail. And it's been forgotten, but every doctor should know about it. Not just general practitioners, but people in secondary care and hospitals. They're constantly treating menopausal women, but probably without realizing that their symptoms they're seeing them for could be due to their hormones. And so, is a massive educational sort of undertaking. This is the key: education for women to understand their symptoms, so they're not frightened by them. They understand what's going to happen, and they can be empowered to read about options for treatment, and then manage their menopause as they would wish. We need education for healthcare professionals as well. We need education in the workplace. The whole of society needs to be educated about what menopause is. And we're making great progress with that. Generally, as a society, we've had documentaries. Louise Newson is a leading light, really, in really getting the information out to people, to women.
Yeah, if it wasn't for Louise, I wouldn't have realised what was going on. It wasn't until
Absolutely.
I listened to her podcast, then I got her book, and I thought, this is definitely what's going on. And I can't believe that my GP's not even. I couldn't believe that I was the person who was bringing it up to the GP and not the other way round, if that makes sense.
That's right. Well, we've had this awful situation where, the problem is there's two people in the room, the patient and the doctor, and neither of them know very much about the menopause. So it's a difficult conversation. So, by educating women and empowering women to say, look, I think this could be due to my hormones because I've done some reading, and what do you think? That makes me as a GP, it makes my life so much easier, because poor GPs are really pressurized now. We only have 10 minutes, which is far too little to spend with a patient in this day and age. And so, it's very, very difficult when there are multiple symptoms of menopause, and the patient might go in and think, gosh, I better only discuss one thing because I've only got 10 minutes. So you get sidetracked and you go down rabbit holes of pursuing one symptom. Whereas if we could step back and look at the root cause, really, or actually it's not just my muscle pains, it's my sleep, it's my mood, and my periods have changed a little bit, and perhaps having flushes and sweats, immediately then we can perhaps step back and think, hang on, could hormones be at play here, and what are we going to do about it? And that gets the conversation off to the right start. And I would always say to people, just download the Balance app, the free Balance app. This is Louise Newson's app. I'm a director of the app for transparency as well, but it's free. And it always will be free, and it's got over 20,000 pieces of evidence-based information, all checked by Louise or written by Louise, about all sorts of things, of the symptoms one can have, treatments, a lot about HRT. There's a community on there for people to discuss things with other people, and that's hugely reassuring, actually, when they're troubled by quite severe symptoms, and it can be quite frightening. But talking with the peer group can be helpful, and lots of access to other things like exercise hacks and nutrition. So it really is a sort of whole, all-encompassing app for hormonal problems.
Yeah, I use the app. I've downloaded the app. I used it to track all my symptoms, track my periods.
Yes.
And then I used it to print off a summary that I then took to my GP using the app.
That's just perfect. It's just perfect.
It's great.
What you should be doing.
And I still use it now to track my periods, because
Yeah.
otherwise I don't know what's going on with them.
No.
And I also have used the community a couple of times when I'm like, I don't know what's going on with my HRT, or this is a bit weird, or this has happened. And it's great. And I get it's a really nice chat on there, really supportive. So yes, I would definitely encourage everybody to download the app if you're having any symptoms at all, even before you think you've started the menopause.
Yeah, it's just information, and you know, with information becomes power. And the health report is very useful as a GP, because at one glance I can see, look, the patient in front of me, their periods have changed, they're not regular, and on the other page is all the symptom scores of 34 symptoms. There are more than that, by the way, but the commonest sort of symptoms ticked, how severe they are and how they're changing month to month. So that helps me immediately get into the sort of thought processes. This could be some hormonal changes going on.
Yeah, exactly. I imagine we're going to talk about this a lot in this conversation, but can you quickly explain HRT and its benefits to women who might be going through the menopause?
Yeah, so we'll go a step back before that. What is the menopause? Because not everyone really quite understands what that is. And it's usually natural, but it may not be. But it usually occurs at the age of 51 here in the UK. And this is when the ovaries sort of run out of eggs and stop producing eggs and stop producing the hormones associated with that, estrogen, progesterone and testosterone. And our periods stop, and the average age is 51, as I said, in the UK. But it's only a look back in time sort of diagnosis. You have to wait a year after your periods have stopped to say, oh, I am now menopausal. But we must remember that at least 3% of women will go through an early menopause under the age of 40. And premature menopause under the age of 40, and an early menopause under the age of 45. So it affects all ages. In fact, our youngest patient is 15, and one of our oldest patients is 80. So it affects everybody, and it can be natural, or it can be surgically induced when someone's had their ovaries removed deliberately, perhaps because of endometriosis or from a cancer treatment, or as a side effect from medications or cancer or radiotherapy for childhood cancers or cancers at a younger age. So it affects everybody. So we can't just judge and think it's this typical middle-aged woman with grey hair who's menopausal. It's everybody, and we've got to get that into the psyche as well, because people are being neglected otherwise. So it's when we start running out of the hormones. The perimenopause is the time when the egg supply is diminishing. We're not producing reliably an egg every month, ovulating every month. So this is a time of real flux of hormones, and it can precede the final period by up to 10 years, when our hormone levels are up and down, as the ovary is beginning to fail and not functioning properly. It can chuck out very high levels of estrogen 1 minute, and then the next minute plunge down to very low levels. And this can cause a lot of problems for women who might not be thinking about menopause or perimenopause because perhaps they're in their early 40s. Their periods can change very slightly as well. But this is the time when we can have a lot of symptoms. And the most devastating symptoms for women really are the brain symptoms and the psychological symptoms. So lack of sleep, insomnia, surviving on 2 or 3 hours of sleep night after night after night. Irritability, low mood, increasing anxiety. In fact, I don't think I've ever really met a woman who hasn't had a degree of an increasing anxiety with their perimenopause or menopause. So multiple symptoms really can floor women. We know that 25% will have severe symptoms. Now, some won't. Some 25% may have quite mild symptoms. So there's a huge spectrum. We need more research on why that would be. But there's a huge spectrum of symptomatology and severity. So we must be very careful not to judge people by our own experience, or perhaps our mother's experience or sister's experience. Yeah. So it's a very wide sort of reaching sort of part of medicine. It encompasses many symptoms, and severity can vary widely from person to person.
Mm-hmm. And the benefits of HRT, if we're subscribed to HRT, that can benefit a lot of the symptoms, can't it? It can alleviate quite a few of them.
Yes, so the symptoms arise because we've lost the estrogen and testosterone and progesterone, and these low levels give rise to all these symptoms. So hormone replacement therapy is literally replacing those hormones. And the joy of HRT, as it's called now, is that the newer type of HRT is absolutely body identical, which means it's exactly the same chemical structure as our own hormones that we've lost. So it's replacing like with like, and this means it's even more effective than perhaps the more old-fashioned types of HRT, which was derived from pregnant mare's urine, often, or synthetic, what we call synthetic estrogens and progesterones, which is similar to our own estrogen and progesterone, but not exactly the same. And this more modern type of HRT, which is called regulated body identical HRT, whereby the estrogen is given through the skin as a patch or a gel or a spray, and progesterone is often given as a tablet or in the form of a marina coil. This type of HRT really is exactly physiologically, it's sort of perfect. It fits the lost hormones and replaces it back to a normal female level of hormones, not to a high level like the combined pill, but just back to the normal female level. And because literally every cell in our body has an estrogen receptor on it, it then estrogen really underpins the function of every single organ, from our brain to our muscles and joints, to the vagina, to the bladder, to the heart, to the bowel, skin, and so when we get the right dose of the estrogen and perhaps testosterone as well, we find that the brain function gets back to normal, the muscle aches and pains settle, the sleep improves, and it's individualizing the dose and type of HRT to your patient, and just restoring homeostasis with the hormone levels, so that then women find that their symptoms really respond extremely well. So that really all is HRT. So it's the best treatment, obviously, because it's a hormone deficiency, menopause. So replacing it with the hormones, much as if someone had come to me with a low thyroid, I would give thyroxine. So it's replacing the lost hormone. It's not a different hormone, it's the same. And if we do that within 10 years of a woman's last period or under the age of 60, it will also improve our long-term health, because we know that when we lose hormones, and especially if a woman is younger, under the age of 45, we have increased health risks from living without hormones. We have an increased risk of heart disease. After the menopause, our increased risk of heart attack goes up by 5-fold, an increased risk of bone loss and osteoporosis, thin bones. We know that 1 in 2 women over the age of 50 will develop osteoporosis, and the vast majority of people who have a hip fracture over the age of 65, 70% will be in women. We know that we have an increased risk of obesity, the cholesterol profile, and diabetes, increased risk of dementia, increases when we've lost these hormones. So restoring the hormones within 10 years of a woman's last period or under the age of 60 can halve the risk of heart disease, reduce the risk of osteoporosis, and be a first-line treatment for osteoporosis as well. Thin bones, it builds the bones back up, reduce the risk of diabetes, obesity, and help improve cognitive performance as well. So there's a huge, not only will it help improve, is the best treatment for a woman's symptoms, which is good, and restore her quality of life. Perhaps she wasn't able to work because of her symptoms, so perhaps getting her back to work, which is brilliant anyway, but for free, it will also improve her future health, which is very, very important.
Well, it's an incredibly cost-effective way to help somebody remain healthy for a longer time than if we didn't give HRT and all of those other things happen to them further down the line. So yeah, it's sort of a no-brainer, really.
Well, it is exactly that. It's it can really help. We've done a survey of people attending their GP, and as you can imagine, with multiple symptoms of the menopause, they were often back and forth at their GP surgery with their muscle pains or the insomnia, the migraines, the urine infections, and once that's controlled properly with HRT, that they didn't have to go back to the GP at all. So it saved an enormous amount of GP consultations and referrals. I mean, so many of our patients have been referred to urologists for their urine infections, neurologists for migraines, psychiatrists, rheumatologists for muscle aches and pains. So if we got it in a bit earlier and recognised the reason, we could save an enormous amount of money.
Yeah, and most people's first port of call is their GP, but we hear of women all the time struggling to access HRT, or their symptoms are just misdiagnosed. Sometimes, like as you said, like as depression, and they're given anti-anxiety meds instead of antidepressants instead of HRT. What's the solution for that? Do you think? Is it better training, or is it helping patients advocate for themselves better, or a mixture of both?
I think it's a mixture of both, really.
Yeah,
it's not anyone's particular fault in a way, because, as I said, it's a product of our society that we haven't been taught, and it's just improving education, so everyone's aware of it. We've got done a course for GPs and any healthcare professional as well, which is quite helpful to understand the menopause and treatments for the menopause, and it's empowering patients so they understand what their symptoms are and understand the treatments and understand about HRT, because again there's been so much myth about HRT and the potential side effects, which have been largely disproved, especially with this more modern type of HRT.
Absolutely.
And I can go into that later if you want to. But very safe to take, and even NICE guidance have said the vast majority the benefits far outweigh the risks.
Yeah, they've kind of debunked. Have they debunked? Is that the right word? The breast cancer risk? Is that the right word?
That's right. Yes, I think that's right. The WHI study, which is an enormous study done in the States 20 years ago. We probably all remember, some of us will remember the headlines in the newspapers: HRT increased the risk of breast cancer and stroke. And the absolute travesty was that this was wrong. They had applied the incorrect statistics to the data of this enormous trial. And the investigators said, "Oh, please don't release this, please don't." But it was too late. It had gone to the main media and the medical media. So it's in our psyche for many years that, oh no, don't go near HRT, it causes breast cancer. Now, in fact, they've studied things properly now with the correct statistics, and 2 years later they found actually that women who take estrogen-only HRT, if they've had a hysterectomy, they just have estrogen only, they've had actually a slightly reduced risk of breast cancer, or certainly not an increased risk after 18 years of follow-up, which is quite powerful. The combined estrogen and progesterone for those who have a womb showed that there may have been a small increase in the number of cases of breast cancer, but this increase in number of cases was very, very small, and less than less than the increased number of cases of breast cancer from drinking 2 units of alcohol every night. And this was with the old-fashioned HRT that I mentioned earlier from pregnant mare's urine. And we've had studies with the modern type of HRT, the body identical HRT, had a very good 5-year study saying there has been so far no increased risk of breast cancer with the different type of progesterone, the natural progesterone that's being used. So, the increased risk is very, very low of breast cancer, we've now found out. But we need to get that over to women so they understand that.
Yeah, absolutely. And it does stick, because I still believed that until this year when I started HRT. And I thought, I can't stay on it very long because I'll end up getting breast cancer. And it wasn't until I'd listened to Louise and I found out that actually I can continue taking that until I'm 90 if I want to. It's not the risk actually isn't that bad.
No. And actually, for a young person like you, Ellie, it's really important. You really must have your hormones replaced, which I'm pleased to hear they have been now, because all those risks I've said about the heart disease, the osteoporosis, the diabetes, if a woman loses her hormones under the age of 45, goes into an early menopause, and they're not replaced, they have a much higher increased risk of future health diseases and a higher mortality, actually. So it's very, very important to have that, and it's recommended that really in most cases, the younger woman should have their hormones replaced at least the age of 51, and thereafter it's also fine to carry on with HRT. You should have an annual review because just to weigh up the risks and benefits every year, but there's no time limit. So many women choose to carry on taking it, indefinitely.
And the benefits outweigh the risks probably most times.
Most times it's an individualized consultation. There'll be people with different medical histories, but for the vast majority, when you think we're talking about 51% of the population, that's an enormous amount of people that can benefit. And of course, the ripple effect is enormous, because if we get people feeling better, women feeling better, because they're treated correctly with the HRT, they're often back at work. So that's helping their own finances, the public finances. They're contributing to GDP. They're helping close the gender pay gap, helping close the gender pension gap. They're reaching their potential. They're going for promotion. They're breaking through the glass ceiling. We're talking about how many more women need to be on the boards of companies. One of the problems is menopause. If we don't address menopause in the workplace, we're not going to be able to achieve that. There are other reasons, of course, as well, but menopause is one of them. Is a big reason that women aren't getting their promotion, or we know that many women leave work because of their menopause.
And how can we encourage workplaces to educate themselves on how menopause may affect their workers? Is there any legal protection around it, or?
Well, I think workplaces are getting more interested, and they're probably led by their employers. I mean, they have a sort of moral obligation to look after their employees, and they're now sort of workplace sort of policies for menopause, and there have been a few legal cases now for problems with discrimination because of menopause in the workplace. So employers are really waking up to menopause, plus the fact, and this usually was what pricks employers' ears up, is they're hemorrhaging a lot of money by losing women who are usually at the top of their game, if they're at midlife and they've got a lot of experience. And as I said, from a large study of 3,800 people, we have shown that 10%, and this is corroborated by other studies as well, 10 to 12% even leave their work. And so that they're having to re-employ, which costs them, the sick pay from menopause as well. 51% take time off work, and up to 19% have 8 weeks or more off work due to their menopause. So they actually will save an enormous amount if they get their staff well treated at the beginning. So I think that there's much more interest now, but there's still a lot of work to do, of course.
Yeah, of course. Yeah, I mean, I absolutely believe it, because before I was on HRT, my fatigue was unbearable. So sometimes it was hard to get through a day. So and the difference with having HRT and before, it's incredible. So I can see why that does affect so many women in work.
Makes sense, doesn't it?
Makes total sense. Many of our listeners and our community are therapists. They work as physios or as mental health therapists or podiatrists, etc. So I guess my next question is, what symptoms can be misdiagnosed what menopause symptoms can be misdiagnosed as something else that our therapists might end up seeing in their clinics? And what should they kind of be aware of?
Good question. Well, potentially every symptom could masquerade as another illness, but the common ones are muscle aches and pains. And if you ask a lot of physios, they'll often see women in midlife with shoulder problems, ligament problems, plantar fasciitis, tennis elbow. We know that when we lose estrogen, which is a natural anti-inflammatory, it affects the joints. And some people can be really, really in pain, so they may be at the physio all the time. They perhaps were running and then they can't run anymore because they've got plantar fasciitis. These sort of things, we should be thinking, hang on, is this their hormones going on? Because that will help if they get on the right treatment, can help them. Urine infections, so Urologists will see women with recurrent urinary infections or cystitis, or this thing called interstitial cystitis, which just is a bit of a sort of descriptive term, really. Stinging and burning and discomfort from the bladder, that very commonly gets better when the hormones are replaced. Skin problems with vulval lichen sclerosis and soreness in the vulval vaginal areas, dry skin, resurgence of rosacea and eczema, so dermatologists will see that. Neurologists, often pins and needles are very common, because even estrogen and testosterone affect nerve conduction, and we often see pins and needles, or slightly weaker, the muscle power and strength seems to have gone. I mean, some of these things need to be investigated, because other things could be causing this as well. Yeah. But it's something to think in the differential, especially if the blood tests are turning up negative. Fibromyalgia is constantly, menopause is constantly masquerading as fibromyalgia. We have an enormous amount of people being told they've got that, and they're on medications for it. It hasn't really helped. And yet when their hormones are replaced adequately, these symptoms may often melt away. Cardiologists with palpitations is an extremely common symptom. And neurologists also will see migraine. So I think it affects every speciality, because it affects a woman's whole body. So, the problem is we practice in these silos of expertise. So it's very difficult then for a specialist to step back and look at the whole picture, unless they've been taught, which they probably haven't been mentioned at medical school, because it wasn't a big subject. So
especially if they're in a niche kind of speciality, they've maybe counsellors and some mental health therapists haven't done their medical training, so they wouldn't have come into contact with it at all.
Oh yes, and that's right. Psychiatrists and counsellors will definitely be seeing menopausal women. And so, to have their antennae up and thinking about hormones would be incredibly helpful, just to signpost patients to the right treatment.
And I guess the joy of practicing, running a private practice, is you do have a bit more time to look at the whole story.
Completely. And as I said earlier, a GP, at the moment, is incredibly hard. 10 minutes. Which is, have to be done in multiple consultations probably to get a really good menopause diagnosis. But that's why the Balance app comes in. It's to help GPs. It's written by GPs, for women and GPs as well, to try and get quickly to the diagnosis, to the nub of the problem. And as GPs, we're very good at that, actually. We do think holistically, and we're able to sort of turn our hand to neurology, cardiology, gynecology very quickly. We see all specialities. So actually, it behoves us as GPs to really get to the bottom of menopause quite quickly. And it's helpful for us as GPs as well, because it helps the patient and it reduces appointment times. But it is very difficult. And we do have the luxury of having more time with people. Absolutely.
Yeah, my GP loved that report from the Balance app. She really did.
Yes.
So
yes,
it's
I'm
good.
glad, because that's the idea. It's not to berate. It's not there to berate people. It's not their fault. They haven't been taught, and we're all waking up to it. The whole world is waking up to it all. So as a society, we kind of have to respond and get good education and clear education and evidence-based information. So people have the right tools and feel equipped and confident to treat.
And I think even as a patient, when you go in with the report that you can print from the Balance app, it helps you to advocate for yourself as well, because you're like, okay, I'm a bit nervous. I don't really know what to say, but this is what's going on, and here it is in a report.
It does, because you know what it's like with our brain fog. words fail us, and you might be feeling a bit nervous and a bit anxious going to the GP. You've been kept waiting, perhaps in the waiting room. It's anxious, and you're trying to rehearse what you say, and then you get in front and you can't remember. So if we just put the report in front of you and say, look, can you have a look at this? I think it could be hormones. What do you think? Respectfully, what do you think? Then immediately a conversation starts, and that usually gets you on the right track and can be very profitable for
and it
both
cuts
parties.
down that time in that appointment as well. It's brilliant. It's so good.
No, that's the idea. Well, I'm pleased to hear that, because that's exactly what we hoped. And and then we encourage patients. We're partners with patients, and we would encourage people then to do their own reading, and then perhaps come back and decide, have you thought about treatment options? We can highlight and signpost different treatment options, and then the patient can together with their healthcare professional perhaps decide on the treatments they might want.
Yeah. So we kind of touched on this, but there's more and more public discussion about menopause, from Louise Newson's tireless and life-changing work, she's amazing, to people like Davina McCall. She's had a program and a book out and stuff. So how can we make sure that the best advice and information, and the right advice and information, is put out there, not just for women, but for everybody?
Yes, it's difficult, isn't it? It's lots of multiple informations with the internet can be very dangerous. But I would say come back to the Balance app for women. It's very digestible information. You can go on there, or the website if you prefer that, and as it's free, and you can check the resources and type in migraines or something like that, and you'll find a leaflet or a podcast. In different types, different sort of ways of giving information through the written word or the spoken word can be really helpful for people to listen to and become, knowledgeable themselves. We have a course. We have a course that for all healthcare professionals to do.
Oh, that's good.
Yeah. That's called Confidence in Menopause course, and that's really helpful. We've had excellent feedback from that. It's in modular form, and it's for GPs as well, who have limited time, and they're mock-up consultations with actresses about how you might deal with a younger patient who's menopausal, or someone who's got migraines or vaginal bladder problems, little different scenarios. So that's very helpful and practical too, because we want to know how to do it and how to cut to the quick, in 10-15 minutes. And so that's really very helpful. We've also done a course with the Royal College of Psychiatrists that we've had very good feedback about as well. And we'd like to do more with other specialities, how menopause will touch their own speciality.
And
so
probably most of them it will touch.
Oh yes, so, every single. I can't think of any speciality that will not be touched by menopause, but they won't realise that quite often.
Those courses sound brilliant, and we'll put links to those in the show notes, I think, because a lot of our audience will be interested in those. Finally, I just want to touch on, this is something that came up in the last few weeks that I noticed Louise was talking about, the new draft of NICE guidelines. They cite that new evidence shows that CBT, cognitive behavioural therapy, can help reduce some of the menopause symptoms and should be offered alongside or instead of HRT, which I was quite surprised by. What do you make of these guidelines? What are your thoughts on them?
Well, in general terms, disappointing really, because it's a wasted opportunity. It's a real opportunity to actually explain about HRT, which is the best treatment for menopause, and the new type of HRT and how safe that is compared with the older type. And I think that opportunity was not explored in depth. It's a guidance at the moment, and they're taking feedback and very happy to listen to feedback. So I think people will feed back about that. So I think there are missed opportunities perhaps there. I think, and talking about CBT, their press release, the first 2 or 3 paragraphs was about CBT, just as you've said. Now, CBT is a very helpful thing for certain illnesses, and can really be quite helpful for some people. But actually, to put that as the headline, it has been shown to reduce the frequency of flushes and sweats and may have some impact on mood. But it's very expensive in terms of to access time consuming. The NHS has absolutely no capacity. And the danger is that people think it's an equal. It's a good adjunct in some cases, but that's it. The most important thing is hormone replacement therapy. Of course it is. It's a hormone deficiency. It's replacing with hormones. And especially for young women like you, Ellie, it's really important that women do have their hormones replaced, because they have a slightly excess mortality if they don't, and an increased burden on their health if they don't have these hormones. It's serious. And so I'm not disrespecting CBT, but it's not appropriate to be using that, focusing on that. And I wouldn't want people to think that's that's the way. The best treatment for menopause, the best treatment is HRT, and that everyone agrees on that. It is the most effective.
And CBT on the side is great, but
yes,
HRT
some people do find it helpful, and so if someone would like to look at that, then that's fine. But usually, the HRT will help psychological symptoms if using the right type and dose of HRT.
Well, I can back that up because HRT has changed my life, and so it's completely resolved almost all of my symptoms. I've still got tinnitus, but that I can live with that. But almost all of them. So I can definitely. I was diagnosed with anxiety a few years ago, but my anxiety is also reduced significantly since HRT.
Good. Yeah.
It's
very, very powerful,
incredible.
And it's it can be really transformative, like you've just described in some people. No, it's not a magic bullet for everybody, but it is for an enormous amount. Actually, it can really be helpful. So I think it's important that people hear your story as well.
Before we summarise today's topic, I just wanted to let you know that the Healthy Practice podcast is brought to you by WriteUpp, the software that streamlines your practice, saves time and connects you with your patients. WriteUpp helps over 13,000 clinicians and has facilitated over 4 million appointments. You can start your free trial today and check out all of the amazing features like video consultations, cashless payments, diary management, and having one place to store all of your patient records. Just go to writeupp.com, that's WriteUpp.com. So before we finish today, I just want to do a really quick summary of some of the key points so that we can just remind everybody. So if you could just sum up for me really quickly what the symptoms of menopause are, the main ones. I know there's loads, but the main ones, and what they can sometimes be misdiagnosed as, if you can.
Yes. Well, everyone thinks about flushes and sweats, and they occur in 70% of our patients, but that's 20 or 30% that will never experience flushes and sweats. So if you're waiting for flushes and sweats, you may be waiting forever. So don't base it all on that. Then the brain symptoms, I really need to concentrate on that, because hormones are chemical messengers, and they're like neurotransmitters in our brain. And without them, we can feel very different, increased anxiety, which in some people can be paralyzing, become housebound with it. It can be that severe. Others, it may be mild. So mood changes, because these hormones are very important in our limbic system, which governs our mood, our concentration, our memory, fatigue, motivation. So the mood changes really can be very disabling for some women. The increased anxiety, the low, flat mood is almost like a loss. It's a loss of joy. So everything is grey. It's Groundhog Day. It's get up, go to work, come back, cook, go to bed. The joy, the ups and downs, the excitement, the interest in things has gone. So that's very important. Next space is the muscle and joints. Within the cartilage, some people have very stiff, achy joints. The number of people have bought a new mattress because they're so stiff and achy at night, and in fact it's their menopause. Ligament problems, going to the physio over and over for ligament joint problems, palpitations, bladder problems, increased urinary frequency, urine infections, stinging or burning, unable to hold your urine, a little bit more, perhaps incontinence, vaginal soreness and dryness, and to the point that even wearing underwear can be very painful for some people. Migraines, very common symptom. Tinnitus is a common symptom as well, and often that can get better when your HRT is optimized. But it's getting your dose optimized is another key thing about treatment. So I think that sort of encompasses most of the symptoms. And
it's easy to see how a lot of those are misdiagnosed as well.
Oh yes,
really
misdiagnosis is the next bit. Sorry, yes. So yes, you can imagine with muscle aches and pains, fibromyalgia, even seronegative arthritis. I've had people on heavy duty medications, hydroxychloroquine, and we've got them off once their HRT has kicked in. Migraines on multiple medications to help stop the migraines without hormones being thought about. Psychiatry, so 2 or 3 major antidepressants. People have had ECT, lithium, and again, because people don't think perhaps the mood disorder of menopause is very mild, and some people it might be, but it can be devastating for some people. And yes, hormones can really cause significant, severe symptoms in all these different organs. So it can masquerade as many different things: urinary tract infections, unstable bladder, that sort of thing, really.
Yeah. And HRT, what's the best way that we can access it if we feel like we need it?
Well, I think the NHS, the GP, really. It's all available on the regulated body identical, which is the only ones I prescribe. In fact, occasionally I might use a different one for patient choice or preference, but it's so superior. There's no increased risk of blood clot if the estrogen's given through the skin. So a lot of women said, oh, yes, we can't have HRT because you've got migraines or you've got blood pressure or you're overweight. It's not the case with estrogen as long as it's given through the skin. So women who've had blood clots in the past can have HRT as long as the estrogen is given through the skin and the body identical progesterone is used. So I think going to your GP would be the best, is sensible. And very good GPs who are very well informed now about menopause. And then I think people who are struggling may need a referral to a specialist clinic. There are a few in the NHS, but they've often sadly got long waiting lists, but you can ask for a referral to those as well. And of course there are private clinics, but the majority of people can't afford that and need to go through the NHS, and the NHS does provide that service.
Yeah, absolutely. Finally, before I let you go, if you were in the audience right now and you're struggling with peri or menopausal symptoms, what would be the one thing you do this week to try and address that?
Well, do you know what I do? I would download the Balance app or go on the website if you prefer websites, balance-menopause.com, and read about it. Empower yourself, like you did actually, Ellie, to understand your symptoms, because actually just understanding your symptoms can give great peace to people. Just women coming in my clinic, and I can reassure them that they haven't got dementia, they're not going mad. They're hugely grateful just for that, and I haven't even sort of necessarily treated them as yet. So being empowered with knowledge is really a positive experience, I think, and can give you hope and understanding of how to manage these symptoms that we don't have to put up. Please don't put up, suffer in silence. If there's one thing I can say, please don't suffer in silence. There's so many very safe treatment options out there for you.
And actually there is a page on now, I can't remember if it's on the Balance website or if it's on the Menopause Charity website, but there is a page on there, and I will find it, I'll stick it in the show notes. It's about what to say to your GP, how to advocate for yourself with your GP, and it's a fabulous website page. And it's definitely from you guys. I'll put it in the show notes, but it's brilliant, and it just sums up really nicely how to speak to your GP, what you need to say, and what you need to ask for, and that really helps, I think.
That can be really helpful. And we've talked about HRT a lot, which is appropriate because it's the best treatment, and there's been lots of myths about it, which I hope I've been able to bust quite a few today. But of course, when women are feeling better, it's also really important if they can, to look at exercise, nutrition, diet, to protect their future health and help some of their symptoms. Changing the diet can also help symptoms. Vitamin D in the diet, weight-bearing exercise, cardiovascular exercise, relaxation techniques are also very important to do alongside HRT.
Yeah, definitely. Thank you, Rebecca. It's been fabulous. Where can our listeners follow more of your work if they want to get in touch or find you online?
So, well, you could look at Newson Health website. There's lots of resources on there. If you scroll down, there's something called the Menopause Library and Resources, or just the Balance app, which is free, and go and have a look there. But that's where we are. We're in Newson Health website.
Wonderful.
And
That's
Instagram,
great.
We do a bit of Instagram as well. Louise has a huge following. I have a small
Yes,
following.
I follow on Instagram, and she does a fabulous. I think every Sunday she does a live on there, which is really, really good.
Yes, she's been doing lives on Sunday, and also Louise's podcasts. They've had 1 million downloads. They're really, really insightful, actually, and hearing women speak or other professionals from America, from the UK, from Australia, in different specialities, oncologists. We've produced a lot of information for people who've had breast cancer and how they might want to manage their symptoms. A lot of information there. Louise has written some very good books and I would recommend anyone to read that. It's a good Christmas present. Last minute one, it's so informative, and you can dip in and just read little sections. So that's where you'll find us, really, in Louise.
Yeah. The podcast is brilliant, and the book also great. And I have gifted the book as well.
Oh, well
I'm a bit of a super fan, it turns out. But,
well,
but it's just so useful.
As long as you're benefiting, that's good, and you're helping other people, which is brilliant. Yeah,
it's great. Well, thank you so much, Rebecca, for coming on. It's been an absolute joy to speak to you today.
Not at all. Absolute pleasure. Thank you, Ellie.
And that's the end of today's episode. I just wanted to say a massive thank you to Rebecca. She did an amazing job breaking down all things menopause for us. I really hope it encourages you to better advocate for yourself and for any of the women in your life, all the women that you treat in your practice. Remember to check out WriteUpp.com for all of your practice's software solutions and to start your free 30-day trial. No payment details are required. Thanks for listening to the Healthy Practice podcast. If you enjoyed it, please do leave us a review. It really helps more than you might think. Thanks, and I'll see you next time.